So we'll talk about quarantine and disinfection. So you need to quarantine for 14 days after panleukopenia is known to have occurred. Cease all intake of cats if possible, because if there's an outbreak, you really are in an emergency situation with this very severe disease, and you want to make sure that you don't expose more cats to the disease. You've got to actively manage your population. So you separate cats out into groups. Are they clinical cases that need to be quarantined? Perhaps they're in contact but not clinical, like those green cats, group 1 in our traffic light system. Incoming cats, if you can't close to intake, you've got to protect those incoming cats and make sure that they're not in contact with infected animals or even animals known to be in contact. And of course, kittens are a special high-risk group because of the potential lack of protective immunity that I was talking about earlier. So you need to make sure that they're separated from the population as well. Throughout, you need to continue your vaccination protocols, okay? Even if an animal is in contact, you're worried about it, continue vaccinating. That's probably your most powerful tool. Once a cat shows clinical signs of disease, probably vaccination is a bit too late by that stage, but all other cats must be vaccinated with modified live vaccine. Handle quarantined cats last, okay? So cats that are known to be at very low risk, you start with those first. They might be fully immunised and they have not been in contact, and you handle infected cats last. If you have any suspect cats, do fecal antigen tests and run blood smears as well. Both of those pieces of information can build up a picture of a diagnosis that you can make. It is okay to move quarantined adults to a lower risk group a week after they've been vaccinated. So this is if they're fully adults, they're over 16 weeks of age, and they've had a modified live vaccine a week earlier, you can move them out into a lower risk group and perhaps free up some space. You also need for each of these areas to provide a separate set of essential equipment, so you're not taking equipment from one place to the next. Fomite spread is really important with this disease because the disease is so long-lived in the environment, on your clothes, on your hands. It is really, really important that you don't have fomite spread. So you want to make sure that things don't get taken from one room to the next. You need to make sure that your disinfection protocols are exactly what they should be, just like I was saying earlier about that telephone number. Unless you do it exactly right, you're not going to get through to the number that you wanted to call. So you do have to clean first with soap or disinfectant. If you miss any areas and there's feces or urine or vomit left, then you will have fomite spread. Use protective clothing. If possible, if you can manage it, make it disposable clothing and don't take the clothing from one room to the next. Booties are better than the foot baths because foot baths get inactivated very quickly. Remember what I was saying before about organic material will inactivate disinfectants? So, you know, what better conditions could you get for inactivating a disinfectant than in a foot bath? Gloves are also really important because it's difficult to clean your hands really well and to kill that virus from your hands. So if you can use gloves and disposable gloves, all the better. You need to use disinfective agents that are going to kill this virus. So potassium peroxymonosulfate, which is Virkon or trifectant, or 1 in 32 bleach will work, okay? Those are the disinfectants that will work against Panleukopenia virus. Just remember that you need to make sure that you handle these disinfectants well. You shouldn't be exposing them to light. You shouldn't be exposing them to organic material. And you should be making them up fresh at least every couple of days and allow them full 10 minutes contact time. Just so you know what won't kill Panleukopenia virus, quaternary ammonium disinfectants such as Rocal, 222, Parvasol. Who would know that? Parvasol, why would you call something Parvasol if it didn't kill a parvovirus? Well, it doesn't kill feline parvovirus, so it seems that names aren't always what they say. So quaternary ammonium compounds will not kill Panleukopenia virus or canine parvovirus for that matter. And also the hand sanitizers, alcohol-based hand sanitizers, won't kill Panleukopenia virus either. With any infectious disease, an important part of it is to reduce the load of the infectious material, and by washing your hands, you're going to drastically reduce that load. But you're not actually going to be able to kill off all the Panleukopenia virus on your hands, which makes gloves, disposable gloves, very important.
So, you don't know,
well, so the question is, would you recommend changing gloves between every single cat cage while the staff is cleaning? Ideally, yes. If you can afford to do that, that would be an ideal situation. If you can't afford to do that, you've got to remember that if you've got all of these animals in the same risk group in a room, you're going to be moving between those animals with your clothing that may have been sneezed on or whatever, and there's going to be fomites on that. So in that way, probably changing gloves is not going to get the whole problem because you're moving between cats. Hopefully you've managed your population so that you've got risk groups separated though. So. No. Well, incoming cats themselves are a risk group. So, that is one of your groups. So, and then there's they're an unknown risk group, but they are a risk group. They are lower risk, for instance, than cats known to have been diagnosed with the virus and are clinical. So, separating out incoming cats is a management tool that you can do.